Sathya Rao, and good afternoon, ladies and gentlemen. Thank you all for joining this virtual medical online talk. I'm Dr. Vignesh, the medical coordinator of SSIOM Malaysia. This is our fourth medical online talk organized by SSIOM Malaysia since COVID-19 pandemic hit globally. As someone said, the show must go on. Not that this is a show, but I appreciate the effort from all of you to be together virtually. This is the right step to forge synergy between all of us as one goal to flatten the COVID-19 pandemic curve. Today, our speaker will be talking on vaccination and the relationship with our immune system. The topic for the day is sleep up for vaccination. What should you know beforehand? Before I invite our speaker, let me introduce to you about our very young, vibrant, dedicated, our dearest Dr. Sathya, and about his information, a little bit of. Dr. Sathya Rao is a medical specialist in the field of family medicine. He has completed his MBBS degree in International Medical University and has completed MD Masters in National University. He is currently the head of department in Klinik Kesihatan Ampang and has been serving 1,700 patients per day. And that clinic has been serving as a COVID-19 center since February 2020 and up to date. And Dr. Sathya is also the person who has set up the first COVID center in Klinik Kesihatan in Selangor State. He also set up the first COVID assessment center in Hulu Langat district. He even set up the first pusat pemberian vaccine in Hulu Langat and have vaccinated close to 20,000 people. And he has worked in MAP Sedang, Pusat Quarantine and Rawatan COVID. And he is one of the author of Post-COVID Management, CPG, Clinical Practice Guidelines in Malaysia. And of course, he has given many talks and been invited as panel member on vaccination, not only district level, but to the national in the radio and TV interviews. So without further delay, I would like to invite our very young, vibrant, and 200% dedicated, our superhero, Dr. Sathya Rao, to our topic, to our speech today. Thank you.
A very good afternoon to everybody. Um, I'm very pleased and happy to join for today's talk. And in fact, it is really a surprise that we could actually come up with a topic at this point of time where, there's a lot of things happening in everybody's life. But I think it's really the best time since it is the lockdown time. So, dear brothers and sisters, ladies and gentlemen, I would like to speak about a topic that's very close to my heart. For the last 1 year and 3 months, I think we've been handling COVID, and then we came up with handling a lot of issues that is close to the public health factors, and one of it, of course, being vaccination. So, dear ladies and gentlemen, if we want to know about vaccination, I think it's mandatory for us to first know and understand what COVID as a disease is. So in the first part of my talk, I will spend a little bit of time speaking about COVID as a disease, what happens, how do we prevent, and what happens once a person gets COVID and when they recover. And then I'll speak about the strategy of Malaysian government on handling COVID in Malaysia. And eventually I will zoom into today's main objective, which is to speak about the vaccination itself. So allow me to share my slides so that it will be a little easier for all of you to appreciate the content of my talk today. So to start with, let's ask all ourselves one question, one very pertinent question, which is how to prevent COVID-19. I think in the last 1 year, we all have learned a lot of things from either the social media, from our families, from talks and this and that. And very essentially, we understood that, COVID-19 is caused by a virus which is named as SARS-CoV-2, which is severe acute respiratory syndrome coronavirus 2. Why is it SARS-CoV-2? The SARS-CoV-1 was the SARS that came in to the world in about 2003, and about almost 17 years thereafter, we're having a very similar coronavirus infection, and that's been named SARS-CoV-2. And all of us in our mind, of course, this is how SARS-CoV-2 looks like in our mind, but in reality, actually, this is how it looks like. The same virus, it is only infectious when it is within the cells of our body. When it is around and surrounding environment, it really is not very dangerous for us. But when it comes into our body, it becomes a severe acute respiratory infection, okay, which we now call it as COVID-19. So if you can see this photo, this is an electron microscope photo whereby the cells, okay, our normal human cells that look like rounded shape, and some looks like the footprint. Inside it, the arrows are showing this rounded looking things, and those are the virus particles. Once the virus enters the body, okay, through either the nose, eyes, or mouth, the virus will become infectious. But now, to prevent, in other words, in Malay, pencegahan. So to prevent this virus, very importantly, we must make sure that our hands are not really touching our nose, eyes, and our mouth. This way, we can prevent the transmission of the virus from the environment into our body. So once the virus enters the body through these three apertures, the virus enters and harbors itself in the nasopharynx, which is, you can see at the back of the nose. So this is where the virus will start surviving and trying to infect the rest of the body. That is also the reason why when we take a swab test to confirm COVID-19 virus infection in our body, we put it right into the nose and right to the end where it touches almost at the entrance of the nasopharynx to take the sample. Once the sample is taken and a person is defined to have the virus within the body, thereafter that means the person is infected. So how long does it take for the virus once has entered the body through our nose, mouth and eyes? How long does it take for the virus to become infectious? It takes about 3 to 7 days, though the incubation period can be up to 14 days. So the virus, what happens is a lot of times when somebody is in touch with someone who has been COVID-19 positive, immediately we do the test. And we do the test and we might be having a negative results. That doesn't mean the person has negative COVID-19 because it might take up to about 7 to 10 days before the person becomes COVID-19 positive. Hence, a repeat test at day 8 is very essential. Now, how do we prevent COVID-19? The question simply by preventing the virus entering the body through the nose, mouth, and the eyes. Hence, washing the hands regularly, making sure we wear the mask, either face mask, face shield, and making sure we have a distance of almost 1 meter between the person that we speak to and the person that we are in contact with. So by preventing this, which is essentially the SOP that has been put up by the Malaysian government and the suggested precautionary method by the World Health Organization, hence the disease can be prevented. I think this is something that all of us know from before. And also we must make sure that we must prevent the 3S, which is sesak, sempit, and semang dekat, which is speaking in a very close distance, being in a very enclosed area, and making sure that we are not in crowded places. And these can prevent COVID-19 from spreading from one person to the other. So now, coming to the second question about COVID-19 itself, how is COVID-19 detected? We detect by two means. Number one, by doing the test. Once the COVID-19 test is done, the results will be out in this manner. This is a PCR test. There's also other tests that can be done, like the rapid antigen test, okay, rapid antigen antibody test. Those are all available. But basically here, we use mostly the antigen test in Malaysia. We don't really use the antibody test. So once this test is done, it can determine if the virus is inside the body of a person or not. After about a few days of, like, assuming in our country, we take the policy of 8 days from the time of the first contact, the second test is done to make sure the virus has not incubated in the body and it has not detected to be positive. So detection is not just in one fold, but there's also detection of the close contact. Close contact detection is very essential. As you can see in this photo at the lower part, on the first day of getting COVID-19, we usually will take about 7 days prior to the time of positive test for an individual. And then we see who are the people that they have been in contact with, and we actually do contact screening for them. But the theory is when a person becomes symptomatic, it's from then on. But if the person has no symptoms thereafter, assuming a lot of COVID patients do not have any symptoms at all. So we need to take about 10 days before so that we will be totally clear whether who they have got the disease from or who they have given the disease to. So now, once a person develops COVID-19, the person will be staged, okay? How do we stage? COVID-19 is staged into 5 stages. Stage 1 is they have no symptoms at all. Stage 2, they have common similar symptoms to upper respiratory tract infection. For instance, they have fever, cough, runny nose, sore throat. You know, in some places with some strains, we can also have symptoms like diarrhea, abdominal pain, extremes of lethargy, tiredness, and all of that. And because it involves at the nasopharynx area, some will also lose the sense of smell and sense of taste as well. In the second category, these symptoms are very much at the upper part of the body, upper part of the respiratory tract, which is the nose, the throat, and the esophageal, the upper part of trachea. Thereafter, the third stage is when the infection has gone down from the trachea to the lungs, where it causes infection in the lungs. So this is where we call, in Malay, we call it radang paru-paru. It's an inflammation of the lungs. So where it doesn't require any oxygen at that point of time. So the stage 1, 2, and 3, which is being asymptomatic, and thereafter they develop an upper respiratory tract kind of symptoms, and thereafter infection and inflammation of the lungs without requiring oxygen. This is mild COVID. And when a person requires oxygen supplement, then they are called severe COVID, whereby they can't be treated outside anymore, and they need to be admitted and referred to a center that has intensive care. And also, thereafter, stage 5 is when the infection spreads from the lung to the rest of the body, causing multi-organ involvement. Okay, so this is what the 5 stages of COVID-19 is. Majority of people will be in stage 1 and stage 2. Well, how do we treat COVID? It's also very essential to understand how COVID is treated. So if a person is in stage 1, it is only observation to see if they have moved on to stage 2, which is symptomatic stage or not. So if they have no symptoms at all, that will be really good, because a lot of people, close to half of COVID cases, will have no symptoms, and they will recover also without having any symptoms at all. When we move on to stage 2, where the person has symptoms, we treat the people symptomatically, which means if they have fever, we give fever treatment, which like Panadol and paracetamol. If they have cough, we give cough mixture. If they have sore throat, we give some gargles and throat-related treatment. Thereafter, of course, when they come into stage 3, which is involving the lung, however, they do not need oxygen yet, we will need to do close monitoring of these people, besides treating them symptomatically to whatever symptoms they have. Why do we need to closely monitor them? Simply because we want to make sure that they do not require oxygen, whereby if they require oxygen, they are in stage 4, and the treatment really differs. For stage 4, oxygen therapy will be the primary mode of treatment. And in stage 3, stage 4, and stage 5, we might also decide to give anti-inflammatory steroids. We might also give antiviral treatment and some other treatment where it is needed according to case. And sometimes, different cases are treated differently. So after stage 4, there is stage 5. Stage 5 is when there are other organs that are involved. And of course, when the person goes into stage 5, they will require intensive care. In fact, a lot of times when they are in stage 4 itself, we might actually push them to intensive care, depending on the case and conditions and the comorbids that the people might have. So in intensive care, we will see if the person have kidney involvement. Sometimes the kidney failure might come. So they will be treated with dialysis, and all that things will have in stage 5. So this is how principally we treat a person with COVID. So knowing all these things now, we've looked at the entire spectrum of COVID. How do we prevent COVID? We saw how do we detect COVID by doing the testing, detecting all the people around them, okay, especially the family members, household members, and co-workers, because really, dear ladies and gentlemen, COVID do not come from people that we don't know. The chances are very, very low. The highest risk is those who we spend time and we are not following SOP, which generally is household members, family members, friends, colleagues, especially when we are eating together, and when probably in certain religion, when they pray together, the chances of the COVID treatment to spread will actually be higher. So now, knowing that, so we've looked at prevention, we've looked at how to detect the disease, we've looked at how to detect those who are around us with the disease, and then we've looked at if somebody is COVID-19, how do we categorize them into the 5 categories that's right in front of you now, and how do we treat them? like all the 5 principles of treatment. Now, let's look at the next aspect. Once they are recovered from COVID-19, they will be discharged. And how do we determine who gets discharged? So now, if a person has no symptom at all, after 10 days of the swab test being positive, we discharge the person home. Like for instance, if some of your family friends or family or relatives have been admitted in either the hospital or quarantine center for COVID-19, then basically if they have no symptoms, after 10 days of the swab test, they will be discharged. If they have symptoms, they will go from the days of symptom or also sometimes from the day of the swab. And also sometimes the decision might be made based on the blood test results to see if ongoing inflammation of the lungs is there or not. So this is how we determine discharge. Sometimes it becomes really very nerve-wracking for the family who's waiting at home, because sometimes there is no communication with the family, and then we don't know if there's why someone is not discharged yet. And sometimes it's also we have communication, but probably because there are just too many patients, there might not be clear answers to the patients who are admitted either in the quarantine center or in the hospital when they can be discharged. So if they are not discharged yet, honestly, most likely it's because either the symptoms have actually got worse or the blood test results have got worse. One of the two is the results why someone might not have been discharged yet. And of course, once they are discharged, they are totally well. In fact, the criteria says that a day after discharge, they can actually get back to work if they are well. And this is where a lot of stigma might come into place, and we are like, oh, the person is COVID-19. I am not going to speak to that person. Or, initially when there was very little understanding about COVID-19, when, someone across our house or, right down the lane of our house, somebody had COVID, we even do not walk in front of the house or do not drive in front of the house. I think all of this was even initially there when we did not understand the disease. I think now that problem should not occur because we totally understand how COVID-19 spreads. And it doesn't really spread if the distance is far. It doesn't really spread if we are following SOP, and it doesn't really spread just by touching something that they have not touched, they have touched, and when we have washed our hands. So once all of this is clear, there's no real reason why we should be afraid of someone who has been discharged of COVID-19. So now we will move on to the next part. What is the situation of COVID-19 in Malaysia at this point of time? The next slide is actually a slide of COVID-19 cases according to state. And if we know this was the statistic at the beginning of lockdown, and if we look at Kuala Lumpur state, 1 out of 38 people had COVID-19. In Labuan, where it's a very small area, 1 out of 40 had COVID-19. And in Selangor state, 1 out of 47 people had COVID-19. And in Negeri Sembilan and the rest of the states are like this. So if we look at Malaysian condition, honestly, dear ladies and gentlemen, it is a very high rate of COVID-19 cases. And COVID-19, as I mentioned before, will not come to a person if they have followed the SOP. So honestly, following an SOP of COVID-19 prevention becomes the most important point of preventing COVID-19 disease. So when the statistic is as significant as this is, a lockdown is definitely imminent. And lockdown has now been in place, and we are trying to flatten the curve, and hopefully these numbers will really come down quickly, and hopefully things might change and everything else can be back to normal soon. Now, knowing this strategy where we are in the midst of a lockdown, we are really in the eye of the pandemic at this point of time in Malaysia. And being in the eye of the pandemic, what is the strategy that the Malaysian government has come up with? There are 5 strategies. This will be in Malay language here, because this is the strategy policy that is being copy-pasted from the strategy book. So number 1 is to prevent transmission. Number 2 is to reduce the disease burden and the death associated with COVID-19. Number 3 is making sure we diagnose early and treat early. Number 4 is making sure we achieve the herd immunity, yeah, which is immunity kelompok by about 70% in Malaysians as soon as possible. And finally is coming up and making sure that everybody follows the standard operating procedure that has been put forward in prevention of COVID-19. So how is this strategy implemented? Number one, to prevent transmission, now we have our PKP and lockdown, and we also contact trace as many people as we can if they are at risk. For reducing the mortality and morbidity, the treatments, CACs, and all that things is in place. For diagnosis, we are doing swabs. For immunization, the PPVs, yeah, pusat pemberian vaccines are opened up, more and more, and vaccinations being ramped up. And finally, the SOP is something that has been put right at number 5, because this is totally out of the control of the ministry or the health department. Really, this is awareness that every Malaysian should have and should follow. So this is really the Malaysian context of the strategy that has been put forward. Why did I share this slide of strategy and literally bore all of you? Simply because I think we need to look at COVID-19 as a whole. Okay, knowing that, strategy number 1, which is reduction of the transmission of the disease, this has been quite difficult because our cases are still very high. And our death rate has actually climbed compared to our PKP1 and PKP2. So that is also something that everyone is struggling, and swabbing is also something that everybody is struggling and doing and all that things. However, there are 2 things that is within the capacity of all of you, dear ladies and gentlemen. That is the last 2. Taking the vaccination and making sure SOP is followed. In fact, if we follow the last 2 strategy alone, we will already not require strategy 1, 2, and 3 in long term. So really strategy number 4 and 5 is the most important strategy in managing COVID-19. So that comes to the very pertinent question of strategy 4, should I take COVID-19 vaccination? Here, I would like to give a disclaimer. So ladies and gentlemen, we all have to remember that COVID-19 vaccination is not compulsory for everybody. It is your right to decide if you want to take the vaccine or not. So that being clear in the minds of all of us here today, I think let's look at why vaccination should be taken, or why I need information before I can make a proper decision for myself. So I will now take you through this process of vaccination, what it means, and how it is taken, how it helps, and what are the side effects and all of those. What should be done and what should not be done. And I hope with that information, you will be able to answer this question for yourself. Okay, that is the objective of today's talk. So what is vaccination? This is taken from the guidelines, it's in Malay, but let me just translate it to all of you. Vaccine is a product which is a part of a virus or a bacteria that has either been killed or made weak, or it is a product that contains protein subunits from a certain virus that will be able to enhance our body to make sure that we do not get the disease, or we do not die of the disease, or we do not transmit the disease to another person. That's the whole objective of, or rather, that's the whole definition of a vaccine and the function of a vaccine. So what is the objective of COVID-19 vaccination program, not only in Malaysia, but in the whole world? What is the objective? Why is this vaccination being done so vastly all across the country in every area that we can? As you can see now, vaccination is not only given in vaccine centers, it's given in private clinic, private hospitals, in halls, in hotels, in shopping malls. It's also being given in like homes, like Rumah Orang Tua, Rumah OKU. They are going from homes to homes, and they're also having mobile vaccination strategies. All these things have been started so that we can actually achieve higher percentage of herd immunity as soon as possible. Of course, we have not been as good as other countries if we compare in the amount of vaccinations that has been delivered. But I think with all of us being on board together with the same heart, I hope that the number of vaccination can be ramped up, and I'm very sure will be ramped up very soon. So now, what is the objective? The tagline of vaccination program in Malaysia is Lindungi Diri, Lindungi Semua. So Lindungi Diri means protect yourself, and Lindungi Semua means protect everyone around you. Okay? But that's funny. How me taking vaccine can protect everyone around me? That doesn't make any sense. But this is what we will look at thereafter after this. How protecting yourself can also protect others. So let's start with the first one, protecting ourselves, lindungi diri. So once a person is injected with the COVID-19 vaccine, the vaccine will create a reaction in the body. Why should the vaccine create a reaction? Because as we looked at the definition of the vaccine earlier, vaccine is a foreign body that is injected within our body. So whenever our body is being injected, or not just injected, whenever we partake something into our body will react. I give you a simple example. When we eat food, the body reacts to the food. When we breathe in, our lungs react to the air. Similarly, when we get a scorpion bite, or when we get an ant bite or a mosquito bite, our body reacts to the bite. Similarly, when there is a vaccine that is being injected into our body will give a reaction. That's normal. Why? Because when our body reacts to the vaccine, that means our body immune system is still functioning, which means our defense, just like Malaysia has the army to defend our country, our body also has our own army, which is the immune system. So this immune system will give a reaction, okay, to the body, so that we will now produce antibody. So now this reaction that happens in the body is the one that a lot of us understand as side effects. Because when we inject somebody, there will be a swelling at that area of injection. That itself is a side effect. But it's really funny if we inject somebody and there is no pain, right? So those side effects are called, they're simple side effects. They're also complex side effects too. So the reaction of the body to the vaccine that has been injected is named side effect. And this reaction also is the one that will result in antibody production. This antibody is the one later will actually protect us. So this reaction that is common that we see in COVID-19 vaccination is either simple reaction or serious reaction. Simple reaction can be pain, fever, lethargy, swelling. You know, some people might be allergic to it, so there might be some allergic reaction on the skin, or we might just feel a bit tired. We might feel sleepy, hungry for some people. So all these things are called simple side effects. Simple side effects, honestly, will happen in almost everybody. And then we have serious side effects. So serious side effects are, for instance, after getting the vaccine, you might faint. Or after getting the vaccine, you might have an anaphylactic reaction or even fits. So this happens immediately. That's the reason after somebody is given the vaccine, they are observed 15 to 30 minutes in the vaccine center to see if there's any serious reactions or not. Because when we inject somebody, if at all there is a serious reaction, it should ideally happen within the first 15 to 30 minutes. And statistics clearly say the chances of serious reaction is about 1 in 100,000 people. That means if we have a population of 1 million, that will be 10. We have 10 million, that's 100. So the remaining 9.9999 million people will not have any serious reaction. So these side effects that is generally picked up within the first 15 to 30 minutes during the observation period will be treated immediately and prevent further problems. So now coming back to the same discussion we had earlier, vaccine is injected, there is reaction that might result in either simple side effects or a complex side effects, and then antibody is produced in the body. So when this antibody is produced, dear ladies and gentlemen, there is a level that the body can produce. Let's simply, for understanding sake, take it as 100. So if a body is able to produce 100 antibodies, not everybody who gets the vaccine will produce 100 antibodies. Some will produce 90, some will produce 95, some will produce 102. So there might be vary. But some might also produce lesser, 50 or even 30, and some might not produce at all. So the body defense really depends on the level of antibody. So that is why we say if an efficacy of 50% and above is good enough for a vaccine to be registered and be administered. So if you have 50% protection, that is really very good already, because you will not have serious stage 5 kind of a disease of COVID-19. So a lot of people will ask that question, right? I've got vaccine, and how come that person has had COVID-19? This really is the reason. So a summary of this, as I've mentioned earlier, vaccine is injected, body develops a bit of reaction that usually lasts from 24 hours to 48 hours. And then the body will produce antibodies within the span of 2 weeks, and it will reach to the optimum level of antibody on dose 1 and then dose 2. And this optimum level of antibody will produce body defense. This body defense is the one that will protect us, which is the tagline on top, yeah? Lindungi diri, which is the first objective. This is the one that will protect us from COVID-19. So this is the summary of it. Immunity level is what we are looking at for every individual who gets vaccinated. And when this immunity level is optimum, hence the person will be protected. So how now, lindungi semua, how do we protect everybody? So if you can see the ledger on top, the blue colored human is a person who is not immunized, but still well. The second one, which is green, is immunized individual and also still healthy. Number 3, the red one, is not immunized individual and is sick and contagious. So blue is healthy person not immunized, green is healthy person immunized, and red is unhealthy person not immunized. So if you look at the photo on the left-hand side, where you see a lot of blue, these are all the people who are not immunized and are healthy. And you also see 2 people there who are not immunized and sick. This is the condition in Malaysia right now, the left-hand side. A lot of people are not immunized, but they are still healthy. And some of them have been having COVID-19. So when the disease is contagious and spreads very quickly, it is the photo on the right, which is a lot of people become sick and contagious, and they spread the disease to all the blue people who are healthy. So the disease just increases exponentially. This is what we saw in countries like UK, US, India, Indonesia, where the disease spreads very quickly because there is really not that many immunized people. Malaysia, on the other hand, is almost in the way of becoming like that. Okay, I hope and pray that we will not go that way. And how do we do that? One of the way is this. So now look at the photo on the left. When a lot of people are green in the community, there are some also blue people here who are not vaccinated. And there are also some people who are infected. Who are these people who are blue? These are people who are actually, sorry, yeah. These are people, the blue ones, are people who are having certain conditions where they cannot be vaccinated. For instance, they are people who are allergic to the vaccine, or they are on an immunosuppressive therapy. For instance, they are on chemotherapy for cancer, or something like that, or their immune system will not mount a response to the vaccine. So these are all the people who are blue. Okay, probably those who have taken the vaccine but the immunity has not developed, they are all blue people. But when most people are green in the population, these two red people on the left photo will not spread the disease to many, because the green people now will become like a wall preventing the disease from being spread. So this is the photo on the right that you can see, whereby when there are so many people who are immunized, the people who are diseased will not spread the disease quickly to the other people. So this is how, if all over 70% of us get vaccinated in Malaysia, we will prevent the disease from spreading quickly. So what are the common questions related to COVID-19 vaccine? Number one, can a COVID-19 vaccine make me sick? Dear ladies and gentlemen, the COVID-19 vaccine will not cause you to get COVID-19 disease, because the vaccine is not COVID-19 virus that is being injected into our body. Nevertheless, the things that are injected to us are really the things that will cause a reaction that will actually cause antibody production in our body. Next question, after getting COVID-19 vaccine, will I be tested positive for COVID-19 virus test? If you are well after the vaccine, or even if you are unwell, when we do a test of COVID-19 on you, that doesn't mean the test will be positive. And in case the test turns out to be positive, that is not because of the vaccination, because the test is testing for the nucleic acid, okay, or it is the PCR test that is testing for something very specific that is not injected to our body. Hence, if it is positive, it is because that person has developed COVID-19 and not because of the vaccination. Next question is this vaccine halal? Is it vegetarian? A lot of these questions are asked. Yes, it is halal, and yes, it is vegetarian. Next, is COVID-19 vaccine safe in pregnancy and breastfeeding? So now this is the article from the Royal College of Obstetricians and Gynecologists. And this one is an article that explains about COVID-19 vaccine for pregnant and breastfeeding women. So basically, what needs to be done is, what we all need to understand is, generally, when before a vaccine is given to people, like how it is given now, it is a test period is done. There is stage 1, stage 2, stage 3, and thereafter in stage 4, stage 5 testing, all is done. But because pregnancy and breastfeeding is a group of people who test is not ethical to be done, no big test will be done on all this group before vaccination is started. However, when the vaccination program is already on board and vaccines being given to pregnant and breastfeeding women, then we get a real life data. And the real life data in the world currently is pregnancy and breastfeeding can get vaccination. And in Malaysia, the policy is they will be given the Pfizer vaccine, because the data that has been released in the world currently is from the brand of Pfizer. So can I be infected with COVID-19 virus if I already been vaccinated? So the answer to this question, dear ladies and gentlemen, is that, like we discussed earlier, when we get vaccinated, the body will develop a reaction, and the reaction will produce antibody, and the antibody levels need to be high enough to prevent us to get COVID-19 virus into our body. However, if our body has not mounted enough response to produce enough antibodies, we do not follow the SOP of protecting ourselves from other people, the virus can still enter our body and we might still get the disease. Depending on the level of immunity that we have of the antibodies that are produced due to the vaccination, the body will respond differently. Most people will be no symptoms. Even if they have symptoms, they will be mild symptoms. Very, very, very rarely they will develop into severe COVID-19. And the good thing is most will not spread the infection to the next person. Next question. Okay, Malaysian strategy. Is this strategy enough for Malaysia? My answer will be it is enough. And as we know, the first three strategy is under the control of the Ministry of Health, but having number 4 and number 5, which is vaccination, if all Malaysians, at least 70% able to take the vaccines, we can prevent this disease from spreading within the country. And if all of us, number 5 is even more important, if all of us can follow the SOP properly and optimally, then no one will actually get COVID-19. But dear ladies and gentlemen, I'd like to say that none of us can live inside our house, just one person, without being in contact with anybody outside the world forever. Okay? And as we know, most of the people that spreads the COVID-19 infection is either your family member, your close relative, close friends, or your working colleagues. Definitely, just following proper SOP will be enough to prevent from them. But there will be times that you are not following the SOP within the same home. A person who's working in one factory might be exposed to his colleague while they're having lunch or breakfast. And they might come back home and not wear mask at home and spread it to their parents or to their children or to their spouses. And the disease goes on and on and on. The only way we can break is still by making sure that we have the 70% vaccination within the community. So we need to protect the small group of people who cannot get vaccine because they are either very ill or their immune system do not mount a response, or they have in fact been allergic to the thing, or they have anaphylactic reaction. These are the people that we need to protect by getting vaccinated. So, dear ladies and gentlemen, that comes to the end of my talk. I'd like to share a few of my photos where initially we were very busy with treating COVID. We were fully suited up. Thereafter, we were working in MIPS with a bit more stringent way of managing patients. And now we are all very much focused on making sure that everybody gets a vaccine. And I think vaccination is the way to go for making sure that, we protect ourselves and we protect everyone around us, including those who cannot get the vaccine because of medical condition. And with that, I'd like to end my talk by wishing everybody a very happy Father's Day. Thanks to the Lord of all Lords, my master, and also my parents and my father who have nurtured me all this while. So I'd like to open up for questions and answer.
Thank you so much, Dr. Sathya, for the wonderful topic. And I believe that many people who have doubts on vaccination, who always wanted to inquire, do I get COVID after vaccination, has been very well answered through your talk today. So, ladies and gentlemen, is there any more question that you would like to ask Dr. Sathya regarding COVID vaccine? There is one. They're in the chat box over here.
Brother Vignesh, do you want to read the question to me?
Yeah, can, definitely.
Yeah.
So there's one question they say, once you're vaccinated, you're still able to get COVID-19. So they asked you to explain on that.
Okay. So as I've explained earlier, basically after vaccination, we should not be getting COVID-19, right? Because we are vaccinated, we should have the antibodies within ourselves. So why do some people still develop COVID-19 after the vaccination? It doesn't make sense, right? Government spending millions and millions, I think it will go up to billions to vaccinate everybody. And why do people still get COVID-19, after getting vaccinated? It doesn't make sense. Why should I get vaccinated when some of my friends who has got vaccination and still develop COVID-19? So the answer to this really is, ladies and gentlemen, when somebody develops immunity within the body, they do not really develop full immunity sometimes. So when they do not develop full immunity, why? Why somebody don't? And who are these people who will not develop full immunity? Honestly, we might not know who they are. Okay, they might be people who have difficulty in producing immunity, maybe because they are people whose immune system is a bit dampened. They might be people who are taking certain kind of medications, such as immunosuppressive therapy, people who are on steroids and this and that, who actually might not mount a response for antibody production. Those who are malnourished, those who are not having enough nourishment within our body to produce enough vaccine, enough protein to produce the antibody within our body. So these are a group of people who do not mount a response, and hence they do not mount enough antibody levels within the body. So when the antibody levels are lower, hence the virus might still be successfully incubated within the body and be positive of COVID-19. But generally, they will have very mild disease, even if they develop. So this is the reason why some people might still develop COVID-19.
Thank you, brother. There's one more question. Can you tell us more about AstraZeneca vaccine and Pfizer vaccine, which is being proposed?
Okay.
They
So
say
now,
like a combined dose.
Okay, thank you. Sorry, I was muted earlier. So let me just speak about the brands of vaccine. Let's take it to a more technical aspect. So in Malaysia, we have three brands that is being used. The Sinovac, the Pfizer, and the AstraZeneca brand. These three brands are different, some of them different technology, different way of producing the vaccine and all of that. So now, when we are taking the vaccine, which is the best brand to have? Before even you pose the question, let me say that the most important thing is not what brand of vaccine we get, it's about how much antibody is produced within our body. Because as I explained earlier, the amount of antibody is the most important part, not the brand. Because the body is the one that's going to produce the antibody, and the antibody is the one that's going to prevent the disease. So it's similar to like taking paracetamol. Paracetamol is a drug, okay, that is used for fever. Commonly, we all call it Panadol. But there are so many types of Panadol brands. Some Panadol is called, some paracetamol is called Panadol, some are called, there are different names of Panadol. There are different brands will give it different name. But the core content is similar. So similarly, that is why in Malaysia, whichever brand that you get, I think the faster we get, the faster we produce the antibodies, the faster our body will be able to fight the COVID virus. So that's most important. Now, answering the question that has been put forward, which is it okay to combine AstraZeneca with second dose of, Pfizer or whatever that is? As we all know from now, from before also, there really is no wrong ways of doing things. Only thing is, before we do something, we need to have enough evidence to say that number one, it must be safe. And number two, it must be, the word should be, it must be effective. Medical word is efficacy, but the common word we use is effective. So combination vaccine has actually been proven to be effective outside Malaysia. So whether we are going to 100% implement it or not, it depends on the Malaysian policy. So here at this juncture, I like to inform everyone that there is theory of the vaccine, which is being collected based on research, and there is also country policy. how we implement the knowledge in the country. So different countries will implement it differently. So that is why sometimes we will see that, oh, why other countries not doing this, Malaysia is doing this. It doesn't make sense. Why Malaysia is so, unsensitive? Not really. Whenever a policy is made, the policy is made based on the enough literature, experience, and also the facts that has been put forward. Also, sometimes we will see other countries are all doing, but how come Malaysia has not done? That is simply because Malaysia is a country where usually before we implement anything in a big way, we'll always try to do our own local population research to make sure that it is safe for our Malaysian genetics, so that we don't just rely basically solely on outside. As we even saw when vaccine came into our country, we did not immediately start the vaccination program in our country. We were one of the slower ones in the world because we really wanted to make sure whatever that is brought in was safe and also effective. So that's the answer for the question, Dr. Vignesh. Any other question?
Hey, doctor. The next question is, someone said that they're allergic to penicillin, and is it safe for them to take this vaccine?
Thank you. So basically, when somebody has allergic to many medicines, or they might be allergic to seafood, they might be allergic to dust. All this allergy means the body has the ability to have allergic reaction. So that also means that whatever we take, not just the COVID-19 vaccine, whatever other medicines or food or whatever we partake, we might still be allergic to it. So does that mean if I'm allergic to penicillin, I cannot take COVID-19 vaccine? The answer is no. You can still take COVID-19 vaccine. What's important is we need to know what kind of allergy you have had. Basically, allergy is divided into four levels. The first and the second level is when the allergy is within the skin. Okay, you see skin might get swelling, skin might be red, skin might be raised. The third stage is you will see swelling of the eyes, swelling of the lips, swelling in the upper part of the breathing channel. And the last stage is when there is allergic that might result in anaphylaxis, which is also a part of allergic process. This is when the lungs and the heart get affected due to the allergy. So when somebody develops allergy to penicillin, you need to know which level was the allergy. Was it the skin? Was it swelling of the eyes and the lips? If it is these, level 1, 2, 3, it is safe to take the vaccine. No issues. But you will be observed from 15 minutes to 30 minutes. And then if there is any allergy, they will treat you for the allergy. However, if you have the fourth level of allergy previously, for instance, you were admitted after taking penicillin because you had swelling very bad, and then your heart and your lungs was trying to cope to the allergy, then those people need to be vaccinated in the hospital. Okay, not in the vaccine center, in the clinic, or in the private center or anything like that. It has to be in the hospital setup to make sure that they do not develop anaphylactic reaction. And in fact, even in our centers, we've vaccinated many of them like that, and not hardly anybody develops those kind of reaction, because really it will only develop if the person is allergic to that substance. For instance, in COVID-19 vaccine, it is usually polyethylene glycol, which is PEG. If anybody is allergic to PEG, they are the one who is absolute contraindication, which means they cannot take the vaccine. That is why everyone around them should take the vaccine, so that this person who cannot get the vaccine will be protected. Dr. Vignesh?
Thank you, brother. There's another question. They say that once you're vaccinated, do you need to take paracetamol?
Okay, this is a very important question. I'm so glad whoever asked this question, thumbs up to you. Okay, now, paracetamol is an antipyretic. Okay, what is antipyretic? Antipyretic means it responds towards our body's ability, our body's fighting mechanism. Okay, so what it does is it reduces the body's temperature, it reduces the body's inflammation to a certain level. Okay, so antipyretic means it is the pyrogen. So these pyrogens are things that come from outside our body, and it causes the body to have fever, to have body pains, body aches, and all of this. But it's very essentially to remember, when we take paracetamol before even we get vaccinated, our body might not mount a response to the vaccine that we are giving. When our body doesn't mount a response, our body might not produce antibodies. So number one about paracetamol, do not take the paracetamol as prevention before the vaccine. That's a no-no. Next, if you develop after taking the vaccine, people will say, oh, you take vaccine, you must go back home and you must take the paracetamol. You go back home after 1 hour, you reach home, you take paracetamol immediately. This again is a no-no. Okay? So you only take paracetamol when you develop the side effects to the vaccine, which is you develop fever, you develop body pains, you are unable to stand the lethargy. You take paracetamol to treat your symptoms, which means the dose of the medicine that is given to your body will actually be used to fight the fever, to fight the body pain, and not to fight the vaccine that you have taken. Okay, because the vaccine need to give a reaction to produce the antibodies. Okay, thank you.
Thank you. There's another question. Which vaccine you will recommend for those who are having hemifacial spasm? For example, they say trials have shown trigger factor for Bell's palsy after vaccination. Please advise.
So basically, for Bell's palsy, okay, definitely it will be a condition. Before I even answer before I answer the question, let me explain a bit about the type of vaccines. Yeah. So if we look at Pfizer vaccine and AstraZeneca vaccine, they are mRNA vaccines, okay, which is protein based. And if we look at Sinovac vaccine, which is available in Malaysia, it is actually a weakened virus particle, which actually produces the vaccine. So when we are deciding on a vaccine type, the treating physician, whoever your doctor is, should do something called PVA. PVA means pre-vaccine assessment. So this pre-vaccine assessment needs to be done by your treating physician, because they will know the best what is your exact disease. Okay, because here we might take it as just a Bell's palsy, or even another person might ask about, maybe I'm a kidney failure patient or something like that, and I'm on dialysis, or maybe I have a stroke. So all of that questions I want to lump together and answer this together, which is at end of the day, whatever disease you might have, if you have your physician should actually do a PVA to decide based on your medications and based on your disease stage, okay, what will be the best to be given and where should it be given, in a hospital setup or in the setup of a clinic kesihatan, or in a private clinic. So then a better decision will be made, and it becomes much safer. So type of vaccine, honestly, at the end of the day, only certain vaccines cannot be given to certain conditions like pregnancy, for instance, all of those. So otherwise, there's really no contraindications to any types of vaccine. So it is safe, don't worry. Next question, Dr. Vignesh.
Okay. I'll combine these two questions.
Yeah.
They say that they say that they announced that 12 years and above can be vaccinated. Is it 12 years and above or 13 years and above? And similar question, they said, how come 12 years and above can register for vaccination? That's a question.
Okay, so now, as we know, Malaysian vaccination, okay, this is a question of policy, okay? Remember just now I explained that there is theory, whereby based on the research, based on experience, all of that. So that is theory. And then we have a country policy of how the vaccine should be given. Of course, when we decided on the vaccine, okay, Malaysia used the age of 18 years and above for vaccination, because 18 years you can give consent. Malaysian law permits anyone who's 18 years and above, who are in the right frame of mind, to sign to be given the vaccine, because in Malaysia, vaccination is not compulsory. In certain areas in the world, vaccination is compulsory, dear ladies and gentlemen. Okay, but in Malaysia, vaccination is not compulsory. Hence, anyone who's 18 years and above can sign and get the vaccine. So now with the vast amount of knowledge that we have based on vaccination, it has been proven that the vaccine is safe for younger age group. So when we start a younger age group in countries like Malaysia, usually we will start with the older children. Why older children? According to the Malaysian law, there is something called earlier spoke about consent. That's something called assent. Assent means basically these are children who already know good and bad. They can actually decide for themselves. I'll give you an example. A 15-year-old kid, some of us have children, right? A 15-year-old child might say that, I don't want this. In fact, the parents will say, no, I think it's good for you to take this. Let's say, to go and do a removal of a tooth. Everybody is scared of removal of a tooth, right? Okay. So then, the father says that it's good, you must do it. The child says, no, I don't want. Okay. The child can actually be saying no, all that things. So when the child goes and sees a dentist, if the child says no to a dentist, a 15-year-old child, it's going to be very difficult to remove the tooth. This is where assent comes in. Assent is a child who already knows what they want and what they don't want, basically because of their mental capacity, not because of the age as a number. Because some kids are much more smarter than the other kids. This is assent. So they need to decide for themselves what is good and what is bad. But of course, even if you have assent, the parents must give the consent because the law requires that. So now coming to the question, why certain age group? Because at 13 years and above, so the answer is basically 13 years and above, basically. For now, they might reduce it to 12 or 10 or increase it to 15 to start with. They might just start with 17. This is country policy. It really depends, and it can change from month to month. It might change from even day to day. So now to answer about the consent and assent, so both parent and the child might will be required to give consent, which is father gives the consent or mother gives the consent, and then the child actually gives a verbal consent to be vaccinated. So that's how it works. Okay, Dr. Vignesh?
Sure. The next one, they say, once a person dies of COVID-19 vaccine, is he still contagious to other people? And following to that question, they said normally those who have taken AZ vaccine, right, they need to wait for 2 to 3 months for the second dose. So are they still in high risk due to the body partially carrying the virus?
Okay, let me answer the first question first. When somebody develops COVID-19, can you repeat the first question, Dr. Vignesh? Is it they develop COVID-19 or they got vaccinated with COVID-19?
They develop COVID-19, not
Okay,
vaccinated.
so let's assume that a person has got the vaccination, and because the antibody levels are not high enough to fight the virus load that has come in, they have developed COVID-19 disease. Okay, so now if a person dies because of COVID-19 disease, yes, they are still contagious because the tissue in our body might still be harboring COVID-19 virus. Hence, the way we treat the body of a person with COVID-19 will still need to follow the standard operating procedure of COVID-19 tissue eradication. That's number one. Let's assume a person is vaccinated with COVID-19 and thereafter, due to some reason, every day, thousands of Malaysians die. Okay, some of them might be vaccinated, some of them might not be. But if one person dies and has been vaccinated before, they are not contagious of COVID-19. So the way we treat the body will be same like the rest of the people, not like COVID-19. So that's to clarify both aspects of the body. Now, let's move on to the second part of the question. AZ vaccine has been taken and they are waiting for the second dose and the third dose. Are they at risk of developing COVID-19? The answer for this is everybody is at risk of COVID-19, whether you're vaccinated or you are not. That's number one. Number two is when you have been given one vaccine, actually you're almost 50% protected from COVID-19 virus. Okay, so that's number two. So that is why the aim always is first dose. You will not see complete dose aim as the thing. So usually every country around the world will talk about, we want to give first dose by 3 months. We want to give first dose by 6 months. That is the real rush, because it's one dose protection that is most important. Once you get the first dose, then protection is on board 2 weeks after the first dose, and that's good enough. Yeah, of course, we would prefer everybody to complete the second dose and have a better immunity level before they can actually move on to get the next next part of the disease process. Thank you.
Thank you. The next question is, for those who've been having migraine, is the vaccine safe for them? And number two, what happens if you take the second dose of the vaccine and your immunity is high enough, and will it overuse your lymphocytes? That's the second
Okay.
question.
Nice question. Let's start with the first question, okay? The first question is, I have migraine, can I be vaccinated? The answer is, yes, you can take any of the vaccines. However, is all migraines migraine? Okay, that means you will need to see a physician to make sure that your migraine is being treated. Okay, don't just assume a headache is a migraine always. Okay, so that's one thing. So now going to the second one, which is, what was the second question, Dr. Vignesh?
The second question was regarding the overuse of lymphocyte due to
Oh,
second
yes,
dose.
yes,
Yes.
yes, yes, yes. Okay, so now assuming after you get the first vaccine, your antibody levels are already high. Okay, should I require a second dose? The answer is yes, because based on study of all the 3 vaccines that we have in Malaysia, we know that it will not achieve optimum antibody level. Okay, and let's assume that it has reached optimum antibody level with even the first vaccine. Let's assume, yeah, the best case scenario, and this person is like a superman or a super lady, and the immunity has gone up, up to the optimum level, 100% immunized. Even then, the lymphocyte level will not be used fully. And we know lymphocytes, there are many types of lymphocytes. There are B lymphocytes, T lymphocytes, and B lymphocytes are the one that produces the antibody. And as long as you are well nourished, the body will be able to replace the lymphocytes, because our immune system is a very good immune system. And at every point of time, I'm sure this question is asked by one of our students who is studying. So at every point of time, you have to remember that our body is fighting. Our lymphocyte is fighting with the water that we drink. The lymphocyte is fighting with the food that we eat. Lymphocyte is fighting with the air that we breathe in. Everything is contaminated. Anything that comes from outside. You put your finger in your eye, the lymphocyte is fighting. You put the finger on your face and you rub, the lymphocytes in the blood that is supplying the skin of the face might be activated to see whether anything is penetrating the skin or not. So that's how sensitive and great our body as a machine is. So don't worry, as long as you eat well, you exercise well, you keep your body healthy, your body's lymphocytes will be good enough to be produced and to act, and thereafter to react. Thanks.
Thank you, doctor. There's another question. They say that how if some people are allergic to paracetamol?
Okay, so actually, allergic to paracetamol is common, yeah. As much as all of us think that paracetamol is something that everybody can take, not really. Many people are actually allergic to paracetamol. If you're allergic to paracetamol, the question I want to divide further, yeah. First part is, again, we need to know the 4 types of allergy. When you take the paracetamol, are you allergic based on the skin allergy, which is the first and second type of allergy, or is it the eyes and the lips and all that things? So if they are under the first 3, they can take the vaccine as usual. And if they are number 4, again, they will need to be vaccinated in the hospital. That's done. But again, the question that this person might be asking is, oh, but how if I develop fever after I get vaccine? I can't take paracetamol. How? What do I do? The answer will be, there is no, as if we develop side effects due to the vaccine, within 24 hours to 48 hours, the fever will subside. So when you develop fever due to the vaccination, what you can do is you just make sure that you do tepid sponging, you pre-buy the cool fever, and then you can take a shower. You can take some home remedies for fever, drink a lot of water, keep yourself hydrated. If the fever remain high after 2 days, go and get a blood test done, because not everybody who develops fever after vaccination is vaccination related fever. We are still exposed to dengue, we are still exposed to chikungunya. There's a lot of things can happen. Every time, right, this is something that all of us are guilty in doing, including me for that sense. We always associate every symptom that comes after a certain event to that event. Okay, so we always think that, if I have got a vaccine, if I develop a fever, it must be because of the vaccine. Yes, highly likely, but not necessarily. It could still be other things. So please get yourself checked. So this is the similar thing that you always hear in social media, right? Somebody has taken a vaccine and they have died after that. This is a big fear among many people. So this is again what I need to say, that thousands of people die in Malaysia every day. And thousands of people are vaccinated in Malaysia every day. So it could be a coincidence that people die after vaccine, or it could be an effect of undetermined side effect. So how do we know what is what? Generally, a test will be done thereafter to determine the cause of death of those who are vaccinated. And in Malaysia, for now, it's very safe to say that our rates are very low. Thank you.
Perfect, doctor. That is a very, very important message for everyone because that's a fear that they used to have it.
Yeah.
Okay, the next question will be, they said, will there be a pre-assessment of an individual health concern like allergy? Will there be a briefing guidance given to manage the reaction? And second question, they said that, do I need to ask my doctor regarding as such like 20% of lungs has permanent scar? Will I have some issues? So those are the question.
Okay, about the first one, yeah. Information about vaccine side effects are there everywhere. They are either in social media, they are in brief leaflets that are given in vaccine center and all that things. So, but when you go for vaccination in any vaccine center, generally there will be a talk that will be playing in the video or audio. There will be leaflets that will be given, so you can use that, because different brand of vaccine might have different priority of side effects. Generally it will be the same, but there will be some will have more of body ache than joint pain, and it will be a bit different from one to the other. That information you can get from the place that you're getting vaccinated. To answer the second question, which was in relation to, what was the second question, doctor?
Has a permanent scar in the lungs,
Yes,
20%.
exactly. About the permanent scar in the lung, there is more needed. So let's say 20% of the lung is scarred. That means the ability of the lung is only 80%. And can you imagine this person, the risk of COVID-19 on anybody who have lung or lung related complication is very high to be at severe COVID-19. This includes those who have chronic lung disease, those who have interstitial lung disease, those who have pneumoconiosis, those who have asthma, those who have COPD, chronic obstructive pulmonary disease, those who are smokers, those who have had lung cancer before. These are group of people who must get COVID-19 vaccination, because the lungs of this group of people is already compromised, and COVID-19 infection will be detrimental for this group of people. So, should I get the vaccine? The answer is yes, if you are willing to take the vaccine. As I said, vaccine is your own rights. Okay, and also, what type of vaccine I need to get? Just get any type, because it's safe. All the three vaccines are safe for all this group of people, but do a pre-vaccine assessment so that the doctor who's treating you will know what medications you are taking, and they'll be able to tailor the vaccine better to your medication and your condition. Thank you.
Okay, doctor. There's another question. They say that if I'm going to travel to European countries, they have said that if you have taken Sinovac, then you won't be able to travel to that country. So they say that, do I need to take other brand of vaccine, and can my body take that vaccine? And number two, do COVID able to be transferred through food or grocery packaging during delivery?
Okay. So the first one, yeah, about whether certain types of vaccine in certain countries. So now I'm coming back to speaking about something that is not the theory. Okay, this is called geopolitics. Because certain countries will put ban on certain vaccines because of the way the country works with each other, right? Like, country A might not like country B, and if the country B produces certain vaccine, they don't want to accept that vaccine into their country, or they might not accept people who have taken that vaccine into their country simply because they don't believe the vaccine works. But we know in our country that every vaccine that we are administering has been tested for its efficacy, and all three are very efficacious. Knowing that there should not be any reasons of traveling to any country due to fear of developing COVID-19 virus. But the country itself might put a block. Like, certain country might say that, if you take AstraZeneca, you cannot come to my country. If you take Sinovac, you cannot come to my country. And the country might say that today, and let's assume that, Europe says no, Sinovac people, vaccinated people will be allowed. They can change the decision in about, let's say, 6 months, and say that those who get Pfizer are not allowed to come into my country. Right? So that is really policy, and really, I don't think this will be the best platform to answer the question. Let's just remember the most important objective is to protect ourselves first, and let's protect with whatever vaccine that we get as soon as possible. Thanks.
Thank you. So next question, how long?
Sorry, I did not answer the other question. The second question was about
The spreading of virus through the grocery and delivery.
Yes, yeah. So the spreading of virus through the groceries, honestly, most important thing is we have not had any cases that are tremendously spreads because of certain groceries being brought and this and that. So what's most important is everything need to follow SOP. So when we bring back groceries, make sure you wash your hands, wash the groceries. If they are packed, just wash the packing and bring it back and store it safely. I think it's also a good practice, not because of just COVID-19, but it's also for certain other conditions, like, for instance, leptospirosis, where the mice and the mouse and the rats and, all of this. So I think it's good wherever we bring it from a gudang. I think it's good to wash it before we keep it and consume it. Okay, coming back to Vignesh's next question.
Thank you. There's another question. They say that, how long do a person develops immune once vaccinated? And is the vaccine, is it lifelong protection for us? And will it last in our body?
Okay, thank you, Dr. Vignesh. So basically, it's very essential for us to remember that, number one, whenever we decide when the booster dose is, how many dose is, I give you a simple example. If we talk about hepatitis B vaccine, hepatitis B vaccine is given to everybody who is born in Malaysia from, I think, if I'm not mistaken, from the year 1991 onwards. Whoever who's born after 1990 or 1991 have been vaccinated with hepatitis B vaccine, which is 3 doses of the vaccine. So how do we decide? Some are 3, some are 2, some are 4, some requires every year. For instance, as a frontliner, every year, like Dr. Vignesh, myself, all of us get vaccine with influenza vaccine every year. We'll have to take the jab, because every year there will be a bit of a change in the way the influenza virus is. So a booster dose is required, and every year also the immunity of the body might drop a little bit, hence a booster dose is required. So for COVID-19, really, ladies and gentlemen, the vaccine has only been there in the market for the last almost 5 months. And in Malaysia, it's only been there for the past 3 months. So we do know that studies are required after 1 year of the dose to see whether the antibody levels are dropping, and if it's dropping, a booster dose will be required. So those who have had the first batch of vaccine in the world, not really in Malaysia, in the world, like it was done, I think early this year and late last year. So all of them will be tested again end of this year for their antibody levels to see how the antibody level is And if the antibody levels remain high, a booster dose might not be required for that dose, for the brand. And if the antibody level has dropped, that means a booster dose will be required. So until that decision has been made, let's not spread any speculation and let the study results come out for us to decide whether a booster dose, which is the third dose, will be required in 1 year's time, or even in like some cases like pneumococcal vaccine every 5 years, all that things, things like that will come, and we will see how it goes with the time. Thank you.
Thank you. Another question is, if a person already affected by COVID, let's say he's a COVID-19 patient, he's already been affected, he can get COVID-19 vaccination or not once he has confirmed positive? And is it too late once he has COVID to get vaccine?
Thank you. So again, this is about policy and about theory. Let me tell the theory first. Okay. The theory is if one person develops COVID-19, he will have antibody to fight the next COVID-19 virus for minimum of 3 months, but it can be up to 6 months to even 9 months. The antibody might be within the body to fight the virus coming back into the body. So now, if we know this as a theory, we now need to know about the vaccination. So do we need to get vaccine after COVID-19? Yes, we will need, because our own body's ability to produce the antibody when we have developed COVID-19 is only going to last a minimum of 3 months to maximum of something. So eventually we will still need a vaccine. So do we take the vaccine in immediately after COVID-19, or 3 months after COVID-19, or 6 months after COVID-19? Depends on the country policy. So the country policy for now, Malaysia, is 90 days from the last discharge of COVID-19. You can actually already take the vaccine. So that is how it works in our country. Thank you.
Thank you very much. Okay, last but not least, okay, let's say a person has diabetes, hypertension, and all that. Are they safe to get this vaccine? And also, they say that this vaccine is not being approved by FDA. What is your advice on this? This will be the last question, audience.
Thank you so much for the question, Dr. Vignesh. Let's talk about the first one first. Let's speak about the FDA first. Okay, so now FDA is a body that actually decides, okay, if the vaccine is safe to be administered in the country. FDA is the body that is in America. Like that, Malaysia has our own FDA. So it doesn't mean that FDA has approved something, Malaysia will approve it. It doesn't mean that if Malaysia FDA has not approved something, Malaysia won't approve it. Generally, we will follow FDA guideline because we review technology and methodology in any pharmaceutical board of a country is almost the same. So we don't really need to 100% depend on FDA, but what is most important is depend on the research and the literature. Okay, and also a lot of vaccines are already FDA approved. Okay, some are European board approved. So based on all of that, so that is what the lessons that the experience that will come in. So when we have it in our country, we see how our country population respond to the vaccine and decide our own guide. Okay, so we don't really follow exactly what FDA say. A lot of times it will be almost in sync, which means if something has been barred by FDA, usually we will bar. Why we will bar? Because FDA will not bar anything without proof. And if FDA doesn't bar also, we might be barring the drug before even FDA bar. So, the barring will be same, but accepting into the formulary might be a little different. Some countries might accept it earlier, some countries might accept it slower, and it depends. It's all policy within the country level. And for Malaysia, our own board, which is FDA-like board, is existent, and our National Pharmaceutical Board, which is the board that allows any drug to come into our country, is actually a very strict board. Okay, so that's the one. And what was the first question out of the two questions, Dr. Vignesh?
Regarding the health complication for elderly people who has diabetes, dyslipidemia, and all that.
Thank you, thank you. So I think as all of us are aware, in Malaysia, vaccines are given based on stages. Okay, phase 1, phase 2. Phase 1 was for all the frontliners. Phase 2 is for all those who are 60 years and above and those with comorbid. Stage 3 is all those who do not have comorbid. Okay, so now, and of course, stage 4 has also starting with the industries, because they are not frontliners, but they are at higher risk. And then stage 5 will later probably be for the children age group. So now coming back to phase 2 is the question that's been asked, because diabetes, hypertension is comorbids. So that is associated with a group that are higher risk of developing COVID-19 because their immune system is already a bit lower because of their disease, and they need to be given the vaccine to make sure that they produce enough antibodies to fight the disease. Why they need to be prioritized? Simply because the chances of them developing COVID-19 and being severe COVID is much higher than the ones in phase 3. So hence, we really need to protect this very fragile population, otherwise the death toll of the country will be skyrocketed, just like how we saw it in countries like India, US, UK, where the death toll was absolutely horrendous. And that's not where we want to get to. So it's very essential to remember all those with comorbids need to make sure that you see your doctor, get the pre-vaccine assessment, or just make sure that everybody is registered in MySejahtera as soon as possible. And children, I really hope that you can do it for those who who are not registered under MySejahtera. It's very easy. You go to JKJAV website, or you just put register vaccine Malaysia. The website is already there. You can do it very easily. It's only the name, IC number, address, as well as medical illness of the person. You can do it for anybody in the world, not in the world, anybody in Malaysia, okay, who are living in Malaysia. And just make sure that if they are interested in getting the vaccine, please register them so that the MySejahtera app will be able to detect that registration and put it in easily. And hopefully those with the comorbids and elderly will be prioritized. And it's sad to see, even in my own vaccine center, I'll just, maybe just to end, Dr. Vignesh, maybe 1 minute if everyone agrees. Last week was actually a very sad day for me because I think we hit the target of 20,000 vaccines already in my center. And, like with so much happiness, there was morning talk, every morning we have an update of all the vaccines that's been given and all that things. So with so much excitement, after the talk in my clinic, I was going to the Dewan that I was covering, it's Dewan Kampung Ampang Indah. So I was walking from the parking is a bit further. It's in the school, so we need to walk to the Dewan. So I parked in the school and walked to the Dewan. And this very nice, elderly gentleman, he sells lemang, okay, in very close to my place. And when I walked, he never really he always smiles and says hi, but he never really makes a conversation. So that morning when I was walking, he asked me, Doctor, saya nak vaksin boleh tak? Then of course, many people ask me because we are in charge of the vaccine center, but in my vaccine center there's no real walk-in policy. Unless you have a PVA done anywhere, then only there is an ability to actually be vaccinated. So I told him, Pakcik, kat sini dia tak ada walk-in. So Pakcik punya MySejahtera dah daftar ke? He said, saya tak tahu apa tu MySejahtera. Oh my God, I really felt really sad. There's so many people who are actually in the age group and bracket to be vaccinated, but only because they don't have technology, they don't have ability, and maybe they do not have children to daftar for them, or all these things. I think this is a good service opportunity. Whoever you see that who wants to be vaccinated, help them to be registered under MySejahtera so that the vaccine centers can actually call and remind them to come and get the vaccination. Even if they are not used or good in using MySejahtera, they will be called to get their vaccines. So this is a hit on my head because this gentleman was just outside my vaccine center and he's not being vaccinated. And that's really not something that I want to be proud of. So, I actually immediately spoke to the team, and I said, we need to have a mobile registration area where we can register people who want to get the vaccine, register them so that they will be able to get their vaccines as soon as possible, so that they will be protected, especially those who are working outside and elderly and all that things. So thank you for listening to my story. So yeah, with that, I think I'll pass it back to Dr. Vignesh.
Thank you so much for I would say it's a perfect talk. I think most of us really wanted this talk about vaccines, all about vaccine, which one is the best and which vaccine is suitable and all that. I think all the question has been answered very well. And I'm really sorry for some of you that some question are unable to be answered. However, you can drop your question, your inquiries to ssio.malaysia@gmail.com, and we'll try to answer your question. We'll email to you back. Due to time constraint, I have to end here. So, as a conclusion, I would say that our country, with the help like Dr. Sathya and many people, doctors out there, okay, has been massively deploying COVID-19 vaccine, bringing new hope to fight against a global pandemic that's happening all over, including Malaysia. So, what we can do, how we can help our country, is just only one way: register yourself, register your family members, register your people around you, so that we'll be able to vaccinate everyone and we can achieve a barrier to prevent the COVID-19 spread. So it will be a great aid in controlling and ultimately ending this global pandemic. And of course, we still need to adhere to the SOP, and please take precautions wherever you go, no matter in public or among your family members. I think all the technique of SOP should be followed no matter where it goes or how long it takes for it to stop. Thank you so much.